Hello, guys. Welcome to another episode with Moses. As you all know, I'm a public health practitioner and I work to support change so that people around me and people around the world can have certain knowledge to make profound decisions and drastic choice or wise choice about their sexual health and general healthy lifestyle as well. Of course, this is in the support of the global effort to end disease and pandemic worldwide. Okay, I welcome all of you, my returning subscribers, my new subscribers, and my following subscribers. I welcome you to this episode today. It's amazing to have all of you on this platform. Thank you for following all this while. And to some of you who have taken out time out of their busy schedules to share out this video to their loved ones, friends, and families so that they can be in the knowing of what HIV or what is going on in our world today as per health. Talk about HIV, talk about general women health being and the likes of them, which are still going to come on gradually on this channel. Thank you so much for loving your loved ones as well. Very quickly, if you like my video and you have not subscribed, please kindly subscribe to my YouTube channel by clicking on the subscription button, and and also click on the notification bell for more videos. And you can like my videos and give me a thumbs up so that I will know that yes, you love my video. Okay, today I'm going to be talking about something very important. From my last episode, I made a promise that I was going to be talking about starting the HIV treatment correctly. Yes, there are a lot of people who don't even know how to start this treatment very quickly. Okay, they don't know when to start the HIV treatment. Of course, the CDC recommended guidelines that everybody or everyone with HIV start treatment right away. Okay, so when you are on effective treatment and your viral load is undetectable, you cannot actually pass the HIV to anyone at all. Is that clear? So immediately you discover that, oh, you have been diagnosed with HIV, which is not the end of life, then you kickstart your treatment as soon as possible. Okay, when to start HIV treatment, like I said, is taking the treatment as soon as you are diagnosed. Are there disadvantage of starting your treatment as soon as you are diagnosed? Let's look at some of them. Yes, the advantages of taking HIV treatment cannot be overemphasized. Once your viral load is undetectable, like I said earlier, you cannot actually pass on the HIV virus onto another person, or maybe your partner or children or friends or whoever. Okay, so it might actually take up to 6 months on treatment to become undetectable. All right, so that's number one advantage. Two, you may have less illness. If HIV has been making you ill, you may have less illness. That's why you need to start your treatment as soon as possible. And number three, the treatment will stop HIV from reproducing in your body. Exactly. So the tendency of the virus multiplying or multiplicating in your body system, okay, will be stopped by the act of taking or starting your treatment as soon as possible. Number four is of course your immune system will get even more stronger. All right, because HIV medications like ARVs, for example, they are compounded with some multivitamins and some healthy nutrient that even helps to boost your immune system more stronger. So you see that you starting your HIV treatment immediately, you stand the chance of becoming very more stronger. So some of you might also be asking some questions, very funny question. What will happen if I don't take HIV treatment? Hmm. Without treatment, nearly everyone with HIV becomes ill. Dear. So, if you're not on effective HIV treatment, the virus can attack and even weaken your immune system. Okay, and the immune system is the body's natural defense against infection. So you discover that over time, all manner of infections will just find their way into your body system. Hmm? Over time, when HIV has done a lot of damage to people's immune system, they are likely to, become so vulnerable to, some terrible, terrible, terrible infections. Uh, that's because, the HIV also causes inflammation in various parts of the body, and this can increase the risk of numbers of illnesses ranging from cardiovascular diseases, for example, like heart attack and strokes, kidney or even liver problem, and some cancers. Okay, so the damage that HIV causes happens slowly and often. It takes a numbers of years. Okay, uh, but treatment protects you. As a person with HIV who is taking treatment and has an undetectable viral load, like I said again, you cannot pass on this HIV and you can even live a longer lifespan and very normal lifestyle. Okay, so that is very, very important. Now, what happens if you delay starting HIV treatment? Something terrible actually will happen. So, in the past, people could delay treatment if they weren't ready to start. However, um, this isn't recommended now. Okay, so if you have HIV, the sooner you start the treatment, the better it is for your health. So the START trial found that um, there were there was a 53% reduction in the risk of death or even serious illness if treatment was started when the CD4 count, that is um, the measure of the strength of your immune system, is what we call the CD4 count, was still above 500. Okay, so it's common for people to feel apprehensive about taking treatment, but all you need to remember is that it will enable you to live a normal lifespan. Okay, and then when you're on effective treatment, meaning that you have been taking it as prescribed for at least 6 months and are undetectable, you won't even be able to pass on HIV. Do you understand? So that's why it's very important for you never to delay your HIV treatment. So the last one I'm going to be talking about today is some question. Starting HIV medication while you are in full-time work. Is it possible? Yes. When starting HIV treatment, okay, the number one thing you have to do is to talk to your doctor and make sure that you understand how and when you should be taking your medication, whether it should be taken with food and where to store it. Okay, to avoid being looked down upon and stigmatized. So, one important thing to consider is how you will deal with side effects like dizziness or feeling tired, because some of these drugs actually can cause that. So, especially if your medication kicks in while you are at work, this means that uh, this can be especially dangerous if you drive for work or you do shift work, take care of others, or even operate machineries. It can also put you in an uncomfortable position if your co-workers don't know about your HIV status. That's why I talk about that stigmatization stuff there. Stigmatization shouldn't put you off balance. What you should focus on is how to live longer lifespan. Remember, some of those colleagues of yours you have at work don't even have a healthy lifestyle. Probably some of them might even have cancer or diagnosed with cancer. They may have one ailment or the other, but they are covering it. But you have known your status. All you need to do is to treat yourself and move on. Okay? Ask your doctor if the treatment prescribed to you is likely to cause side effect. So, just to be safe, take a few days off work as you begin your treatment. And if your employer knows about your HIV status, they will be obliged to help adjust your work treatment. I'm very sure of that. So HIV is the name of a virus. AIDS is the name of a collection of illnesses caused by these viruses. Okay. So guys, I will be stopping here. See you in my next video where I'll be talking about the side effects of these drugs. Of course, side effects from HIV treatment are not inevitable, okay? And also I'll talk about the resistance and changing your treatment. Take care and have a lovely day.